what we do every day. We talk a lot about the clinical aspect and the educational aspect, but do we talk about what it really does to us as a person? It changes who we are, caring for these type of patients and seeing this. And so, trauma drama is real, right? Not just the trauma drama the patients roll in with. It's the stuff that we take home that we don't talk about. All right, and so I want to talk about some things about this. I'm going to be honest, I've been doing this for 15 years, been in ED, and then I've been in trauma pretty much the whole time. I still don't have it figured out, how to protect myself and how to make it, it changes from time to time of what kind of coping skills I use. Not gonna lie, a glass of wine once in a while is one of those, right? Some extra sleep, right? Time off. So I wish I could say diet and exercise, but that's so not me. I am not. For me, going to the gym is probably more torturous than dealing with something else. I'd rather work 12 days in a row than go to the gym. That's a battle for me. But anyway, so I don't have it figured out. I don't think we all do. But I think it's something that we can support each other and kind of, here's some, information about. So, we'll go ahead and get this started. Oh, we have learning objectives. Of course we do. I'm going to keep them on there too long. Again, my disclosures. We'll move on. So let's talk about some definitions, some formal definitions. Yes, there is a formal definition for trauma drama. It took me a little bit to find it, but I found one. But let's talk about stress, the state of mental or emotional strain or tension resulting from an adverse or very demanding circumstance. Okay, well that just described my job. Especially me. And I make the nurses even more stressed because I'm the quality nurse, so I'm the one who's like, hey, I saw your chart. Can we talk about that documentation? Maybe you should take my documentation class. Or, hey, you got a Foley in. They're like, no, she's coming. Remove the Foleys. All right, burnout. Physical or mental collapse caused by overworked or stress. Compassion fatigue. As a combination of physical, emotion, and spiritual, and that's our whole job, right? That's like all of it mixed in. Depletion associated with caring for patients in significant emotional pain and physical distress. Trauma drama. I love that term. Exciting, emotional, or unexpected series of events or set of circumstances related to a traumatic event. I don't think that's in Webster, by the way, dictionary, so don't look up trauma there. All right, who feels like this sometimes? There's a couple reasons I feel like this. My husband, getting my 2 kids off to school, and then of course at work, right? So multiple times in the day I'm like, oh, I don't know if I can do this again. Right? What makes a bad shift? For the same patients, is it communication barriers? Is it the person you're having to work with, right? You're like, oh no, they're on. Is it, oh no, not that patient and family again. I can't talk about that bruise one more time. Anyone ever go home and hear alarms in their head when they lay down their head on their pillow? You hear the heart monitor alarm, the food, the tube feeding alarm. You hear the SCDs or the Venadine's going off. You hear the bed alarm. You hear the phone ringing. You hear a ventilator. I can close my eyes and hear those sounds in the middle of the night when I'm trying to sleep. That's a sign of us being overstressed and burnt out. It's a huge sign. So, there's this whole thing about critical alarms right now and like how do we respond, how do things happen. It's happened nationally. It's a Joint Commission initiative. And so no one's really figured it out. And so I had to sit with all these people who work in PI, and yes, a lot of them have RNs with them, but they sit in the tower across the street and do PI work. And we sat with them in our critical alarms committee, and they're like, well, how do we fix this? Cardiac monitor alarms and responsiveness. And I said, I can name 13 alarms that goes off on one patient in my ICU. I have 28 of them. I said, do you know what it's like to go home and close my eyes and try to sleep? And I can't because that's all I hear. And they were like, oh, that really happens? I said, you can ask any one of my ICU nurses. Happens every day to them, right? But we shouldn't get like this. We need to have ways to kind of cope with it. So how bad is the problem? 18% of nurses leave the profession within 1 year. right? You go through school, you're like all excited, you get out in the real world, and you're like, oh, my first patient called me the F word, or called me a B, right? Oh, they just threw a urinal at me, right? Or I now have 6 patients and I have to somehow be responsible for them and document, because if I don't, I'm gonna have to go back to Kristen's documentation class and get in trouble when she audits my chart, right? And we're like, have fun, love your job, right? We put a lot of stresses on each other. 60% leave within 8 years. Do you know why the majority of nurses in particular go on to graduate programs, things like that? They're unhappy in what they're doing right now. They're burnt out. They need to do something different. It's not about the money. We don't get into nursing for money, come on. Right? So several studies have been cited that 32 to 50% of the highest risk specialty is actually trauma surgeons. And I think that there's some documentation specifically about nurses too, trauma nurses who deal with trauma patients. And I think that's a lot. That's a lot, right? That's a problem. So I found this on the AACN website. It recently was released of why there's a nursing shortage, and there's some different things that are related to it. But insufficient staffing, and this keeps coming up with job satisfaction, right? You're short-staffed. You still got an empty bed. We don't close those ER doors, right? You just figure it out. That's what we do as nurses. We figure it out. That's why we like rig stuff all the time. You know, it's broken, don't worry, it's broken. I put some tape on this and now it works great, right? We do. We like MacGyver it, right? And this actually has been related to the increased stress, and the increased stress is actually driving the nurses to leave, right? I thought this was great. In 2005, which is, you know, a while ago now, colleagues found that more than 75% of RNs believe the nursing shortage presents a major problem because of the quality of their work life, quality of patient care, and the amount of time a nurse can spend with their patients. You know, I think that's pretty true there. So this was released in the Journal of Trauma Nursing. I want to, real quick, I know Lynn and I, if anyone saw the Jeopardy game that we did, but I really want to promote joining a professional organization for nursing. All right, I think it's really important. I think it's also really important that our pre-hospital folks also join professional organizations, just as physicians do. You can really get a lot of information. I made some great email friends like, hey, what are you guys doing? This is what we're doing. But the other thing is that the Journal of Trauma Nursing, the Society of Trauma Nursing, is a really great group to belong to. And they really want to promote nursing and trauma nursing in particular. And so I'd really encourage all of you to join and also get yourself certified. You're already good, you're already doing the work, take the test to prove it, right? Just to say, hey, look, we've got this many certified nurses. Encourage each other to take it. It's totally doable. But this was actually burnout, perceived stresses, and job satisfaction. So this was a small study, and they actually said that because they only used their own facility for questioning. It's in upstate New York. So they had 75 participants who went through this evaluation process. So it's a small group, but I think it started the conversation. They were from the ED for the Level 1 Trauma Center, the SICU, and the MICU. And they noted lower work satisfaction and higher levels of depersonalization, but higher satisfaction with jobs. So everyone was satisfied with actually caring for the patient, but they were not happy because of burnout. And typically it was due to environmental reasons. Working short-staffed, not having the equipment you need, nothing about pay, nothing about the patients themselves, right? And they're a challenge all on their own, but that really was not what was burning them out. So they found that the ED and the SICU had the highest rates of burnout. And they related this to the MICU did not care for as many trauma patients. All right? So staffing needs really had a huge factor in emotional exhaustion. I have a 28-bed trauma, neuro, surgical ICU. We stay full. We're also the ECMO unit. So if I have 2 ECMOs running, which is not uncommon, that's a 1-to-1 patient. I have a level 1 come in. That's a 1-to-1 patient. I have a stroke, that's fresh TPA, that's a level 1 patient. Do you think we have that many nurses? I need 16 nurses just to run a normal shift. We keep our charges out of the number to be a resource, but my charge spends the whole time running circles trying to just handle basic stuff. There is no coverage for lunch. We're a union hospital. They're supposed to get coverage. And in fact, we're pretty lucky that our nurses haven't went back to the union and complained about it, because they totally could. But we don't have the staff. I had a night where I came in and so did the manager, and we took patients. And it wasn't, it was just people get sick. One girl was having a baby. What are you going to say? Hold that baby in. We need you tonight. Right? That's not going to happen. Right? Life happens. These patients keep coming. We got to keep working with them. But what I thought was really interesting was the personal accomplishments is critical to improve job satisfaction. So what is that? That's encouraging each other to get certified. I work with another, not Lynn who was here, another nurse, Lynn, who is currently in the unit. She just turned 60, and she's great. She was there when I was there 10 years ago. She runs circles around me. She's one of those that you just, she's just one of those nurses you're just like, oh, she's just, great, right? So what was one of her goals when she turned 60? Was to take the CCRN and the TCRN and pass, and she did. You know how much that made her feel? Like she knew that, I'm nice to my patients, they like me. And I'm like, Lynn, you're there too. You've got 20 years of experience, and look, you just took this test after being in this field for 20 years. She's like, it's not that big a deal. I'm like, this is a big deal, right? So we need to try to have personal accomplishments to help each other. Getting a project, a PI project, right? This is one of my biggest pet peeves about nurses. Like I said, we're really great about MacGyvering things, right? We figure it out, we'll make it work. We'll change something as simple as like color of a binder, add a tab, and it's made the workflow so much easier. And then we don't credit ourselves enough for it. You should be writing that up. You should be having poster presentations. You should be submitting this. This should be going, this is huge. I literally did a PI project at Shock Trauma where I found a binder for the blood sign out for the uncross match that would stay together longer than 3 months in the cooler, in the refrigerator. I wrote that up. I took pictures. I did a poster presentation on it. I got a lot of kudos, and I said, I just went to the dollar store and found a really cheap plastic binder that would make it in there. So that's something we need to do. These are little projects that make our lives easier that we don't do for each other, right? That we don't have these personal accomplishments. But this will help us from getting burned out and help continue with our job satisfaction. All right, so we take all that work stuff, right? What about if we throw in all life? Like I said, I got a husband. God love him. He's in construction. He talks a lot about rebar, concrete, and moving large quantities of dirt. I have no idea what it means. No clue. We've been together almost 14 years now. I learned a long time ago I can't come home and explain, because how do you explain a level 1? Well, and then we opened their chest at the bedside, and then, the doc was like, and then I was hanging blood, and then we were blood, and then that's why I got blood all over me. And he's like, ew. Don't talk to me. Like that's, so what does he say? I went a long time ago, I come home, how was your day? He's very nice to ask, and I say, it was good. And I think in my head, 3 people died on my shift. Wasn't my fault, but 3 people died. I held a mother off the floor from crying when she lost her 26-year-old daughter. But it was good. It was good. It was fun. Right? That's the stuff we keep inside. So then you add on top of that kids. I got 2 small children. Right? I get off work. I'm like, can I beat the traffic? I'm not paying extra at daycare today. Right? Financially. Right? We all went to school. How many student loans do we all have? I'm still paying for my master's. Family illnesses. A lot of us have aging family members, mother or father that we're having to take care of now, right? So you got to put all this stuff on top of what we already have as a stressful job. So how do you go in and keep it clear and focus? So what happens when we get burned out? We're not just become nurse ratchet, right? Grumpy. We all know that nurse. You're like, please retire. Right? You're laughing because it's true. Right? You're like, you're just grumpy. You're mean to everybody, including your patients. But really, truthfully, nurse burnout has been related completely to increase in medication errors, here's all me. This is the quality nurse also talking here, right? So hospital-acquired infections. Now I'm driving you insane even more because our UTIs have went up. Or surgical site infections went up. So now I've just made your stress 10 times worse. Because why? Because I'm getting it from the administration. Who's like, why did you have so many CODIs and CLABSIs this month? Well, my nurses are burned out. They're done. We haven't even hit summer. Summer's our peak. Right? I had 5 people in the last month who were under the age of 21 who were brain dead and donated organs. You can't tell me that doesn't wear on my staff. It does. It wears on me. Right? So nurses, I don't think we give ourselves enough credit because we really do influence patient care. It comes down to us, really happens. We can say, yes, the doctor did great operating and they have tons of talent and they ordered the stuff, but who stops the wrong orders? We do, right? Who takes care of that patient, that bruise, their skin, ensures they're getting enough nutrition, right? We do, and that directly affects the outcome of our patient. And I think we don't give ourselves enough credit. We really, hello, we rule the roost. Sorry if you're not a nurse, I'm kind of biased here, What about this? The results of us burned out and not actually dealing with it. And we just keep working, right? I like the patients, but I'm burned out, I'm tired. What happens? We know about the opioid epidemic. What about amongst ourselves? In December, I started back at U.S. Health at the end of January. In December, we had an anesthesiologist commit suicide in the hospital. My 3rd week at work, I had to confront a bedside nurse who had track marks and was using narcotics from her patient. She was a damn good nurse, I'll tell you too. She was good. If I had nurses who worked as hard as she did and documented as well as she did, I know that sounds bad, but it's true. Our unit would be like A+ all the way. But can you imagine? She got to the point where she was stealing the narcotics from her patient and injecting them, and not even hiding it. Her track marks were on her hand. Do you know what the other nurses? 3rd week on the job. I barely know everyone's name. I barely know where the bathroom is. And I'm like, anyone else notice her behavior? And they're like, well, we have, but we know she's been through, and you don't want to be that person who reports them. And maybe if somebody had reported her 10 months earlier when she started, because there was a significant behavioral change and we had gotten her help, she wouldn't have gotten to that point. She was arrested, she lost her nursing license. She shouldn't have had to get to that point. She was crying for help. There were signs all the way around. She was burned out. And when it says treating a silent epidemic among healthcare workers from the Washington Post, this is an article that came out about suicide. Right? Because we just suck it in, take it home. Yes, everything was fine. It was a good shift. So there's some coping mechanisms, right, that we need to do. Like I said, I'm not good at a lot of these, I'll be totally honest. I'm one of those people where I'm meditating and I'm like, my breathing's going faster because I'm getting more irritated because I'm not getting something done, right? But some people are great at this, right? We do a lot of, at our facility, we actually, U of Health, they realized that this was an issue for not only nursing, for physicians, for our medics, for everyone in the hospital. They actually created a wellness group that's just for employees. So we can get massages at a cheap rate on campus. Not that you get a break to do it, so you'd have to come in on your time off. But still, it's like $25 for an hour, and the guy's like really good. Like he's awesome. And you just sign up online and show up, right? We have Mindfulness Clinics regularly, which is great if anyone's ever done mindfulness. You can find a lot of this stuff on podcasts and things like that. Breathing exercises. I remember one from when I took, and I still use it today, when I took my psych class, my nursing psych class. She was crazy because she taught psych, I think. But she was, like, she had a patient come up to her and like propose to her, and a psychiatric patient, and she went, "Oh, I'm sorry, honey, I'm seeing someone." Why'd you have to explain? Why couldn't you just say, "No, that's inappropriate," but you know what I mean? But you had to like tell her, anyways. So one of the things she taught me, though, that I've taken with me is that breathe in relaxation, breathe out frustration. When I think I'm going to lose my mind for a minute, that's what I kind of do. Take a moment. Breathe in relaxation, breathe out frustration. I'm not going to kill them, I'm going to kill them, right? You know, that's what happens with my children. Just put your shoes on, we need to leave. The other thing is having hobbies, right? Doing something fun outside of what we do every day. I think the big thing is to find somebody and talk about it. Why do we go home and just say, yeah, it was good? You need to find someone to say, that was a crappy shift. You know what? I'm probably going to cry on the way home. I'm not going to lie. Right? Sometimes you just need to find that person you can trust to do that with, where it's a safe space. I think one of the things that we don't do enough is care about each other. Well, she was acting all out of control. What's the problem with her? Why does she have an attitude? Why has he got he's not saying anything. He's not as helpful today. Right? That's our first thought. Oh, she never helps anyone, or they're too busy with blah, blah, blah. When there's a behavioral change or an attitude change, ask them, are you okay? I wonder if someone asked the nurse that I caught with track marks 10 months ago, are you okay? What's going on? You're not acting yourself. I had so many reports of nurses saying, well, her behavior was off. Well, she seemed more depressed. Well, she seemed to... And I said, why didn't you say something? Because I didn't want to be that person and then not be anything and then blah, blah, blah. Right? We have to support each other. We need to actually vocalize the support, not after the fact. Now everyone's like, oh, she was such a great nurse. I loved working with her. Did anyone tell her that then? Right? Thanks for helping me. I'll be honest, I've been in the heat of the moment. I've definitely said my fair share of not so nice things. But later I went back and said, you know what, that was inappropriate, I apologize. Right? Or I went to someone and said, you know what, I know we were in the heat of the moment, but I really didn't like how you said da-da-da. Can we talk about it? You don't have to be their best friend, everyone you work with, right? Because there are those people you're like, definitely personality conflict, right? But you need to still be able to work with them, and we trust each other so much with what we do. Nah, they wouldn't do that. So if you see this, we spend more time at work than we do with our own families. Oh, the gossip. So many units have gossips, they have cliques. We just don't like them. They don't help other people. Who cares? You be that person to not have that continue. You're the one to say, you know what, that's their private life. I think we need to not discuss that. There's no other way to say it. Just have the balls to say it to them. It's uncomfortable, it makes things weird, but if you stop it and you don't allow it, well, she never helps, so I'm not going to help her. That's not okay. You help everyone. You be a team member to everybody, right? So when I started as a newbie nurse, I had that, eat your young alive. Oh, they ate me, spit me, chewed me, stomped on me. And I was like, what did I get myself into? And then once I proved myself, I was in the group. That was it. I got in. Yes. I proved that I was a good nurse. Why do we have to do that? That was a huge culture we had to change in our unit. We have. We really turned over that. Okay? Anyone heard of managing up? Managing up means that you're promoting up that next nurse. You're promoting up that next person. So you go to do bedside shift report, which everyone should be doing. It's been shown that it's the best way to help prevent errors, things like that. Anyways, I fight with my own hospital trying to get the nurses in there to do bedside shift report. But anyways, before I leave, I go in there and say, oh, so-and-so is going to take over for me. They're great. You're going to love them. Manage them up. Right? Lift each other up. That's all I got.